had a very productive meeting. This follows technical meetings between city officials and officials of the department. And the beginning of that was an engagement which the Minister and I had in Cape Town last week, Wednesday, at an event of National Treasury, where the Minister granted me an audience very kindly on the issue of Rooiwal and how to solve the fact that that plant is under capacity and the city of Tshwane lacks the resources to upgrade the plant by ourselves. At that point in time, the Minister indicated that within a few weeks we would have a technical meeting followed by a political meeting. But obviously the events of the past few days has expedited all of our efforts, and during the course of this week, officials from the city and officials from the department have met. And of course, Minister, there will be further engagements with other organs of state, other departments, other spheres of government, the provincial government in particular. I will, of course, allow the Minister also to frame our discussion, but let me just emphasize that a lot of what we discussed and agreed is subject to further discussions and further agreements also with other organs of state. But it comes down to broad in-principle agreement to form a partnership, to pool resources, and to once and for all solve the long-standing issue of the Rooiwal wastewater treatment plant and the fact that that plant has been out of capacity almost for 20 years now. We have reached, as I have mentioned before, the end of a long line of failures and excuses, and whatever has failed in the past must now be abandoned and must be replaced by this partnership as I have described it. We will have to, as a city, source additional funding. There will have to be additional agreements, but what the department has brought to the table, and which we must now take to other departments and spheres of government, will, I believe, solve the issue. But I want to be very cautious in making any promises that we are going to solve this issue overnight. This is the first step of what I believe to be a clean break with the past, the failures, the disputes, the squabbles, the excuses. I know I've been deliberately vague in this discussion, and I want to provide the Minister with an opportunity to also frame his view of our engagements.
Well, thank you very much, Executive Mayor. I recognize Deputy Ministers and MC that is here. Yes, we appreciate your presence. We've had a meeting from 10 o'clock this morning as organized and agreed on by both teams. As Executive Mayor says, it was a cordial meeting, but very frank on facts and issues that needed to be discussed and raised, which has enabled us, on one hand, to close a chapter where you observe something wrong happening, you don't do anything to correct that or to stop that. A chapter where we link up with Tshwane as DWS via directives and via all other issues, which has painted quite an unpalatable history in terms of the developments of the problem. And as Mayor says, we met in Cape Town last Wednesday, and we agreed that we really need to meet and change the situation around. Open a new chapter. Yes, the happenings of the past few days are regrettable. We have lost 21 lives, and we have to convey our sympathies more and again to those who have lost loved ones. The last time we spoke about this was 17. The number is rising up to 21. and it's quite a developing crisis in our hands. But what the meeting has done is to put that to the past and say, yes, this is how things have been happening. We now agree to change all that. One, by working together. The executive mayor has already mentioned. It's DWS, it's the city of Tshwane, and this is not the first time we work together with a municipality in South Africa. We're working with them. But we are going to be having a meeting or requesting a meeting with Treasury. There are some specific matters that are going to be discussed with them. We will meet human settlements, specific matters with them. But in principle, a document was presented and it was agreed on. All we have to do is to just refine it by getting those departments that have been identified to then comment on the agreement. But I know that the milestone has been reached by the agreement between Tshwane and ourselves, DWS. That opens up other possibilities, which we will discuss with yourselves, or we will present to yourselves as media and public once everything has been finalized. Now, when I talk about that, I'm not talking about next month. I'm talking about next week. We possibly will convene another briefing where we'll be very concrete as to who is going to do what. And secondly, where are we going to source funding? Because obviously this requires quite a lot of money. It was presented there in figures. But we will then say next week where that money will come from. But we'll also say this is the time frame. Now, time frame is unavoidable because we are a government, we are accountable to people. We've got to come up on the clear. Of course, if something happens along the way, I made an example that something happened along the way, Guyana, and people stood up and they wanted to fight us because we had not kept a deadline what was mentioned, which was September. But when we said September, water from Nandoni will have reached some. We didn't mention that. We didn't say there would be Amakos in the area who would be unhappy and wanted us, and it took 3 weeks and so on. So we say we will give the time frame, but of course, if certain things happen, we'll come up and say this has happened, it has derailed our timeline and so on. But next week, we will come back and give you all the details of that. Now, other than that, of course, there are other matters like once we have all the details of how we're going to do whatever in terms of fixing Royal and the whole system. We then have to say in the interim what happens. All of those details we will come back with next week. But what is important that we've delivered today is to agree to work together. And there hasn't been any argument in the past between DWS and Tshwane. What has been there are a series of directives and a spirit of not working together in the past. And therefore, we welcome this new attitude of the executive mayor of Tshwane and his team, that we resolve these matters by agreeing to work together. It resolves almost 50% of our problems once we are where we are now, and we appreciate it. Thank you very much.
Thank you, all right, ladies and gentlemen of the media, I think at this point we can I thought you were losing it. No, I'm just kidding. I thought I was just kidding.
So, all right, so we'll take the questions then. We'll start over here, and we'll take the first round, 5 questions, and then we'll have the second round as well. You say for it?
Sure, Minister and Executive Mayor, William Chidi Jones, ENCA. Minister, just you said the milestone has been reached, but I just want to find out as to, I know the meeting took place, but has Treasury committed to coming on board and assisting with cash flow? Are they saying that they can assist, or we are still in a position whereby we need other partners such as private players to come on board and help with the funding? And you spoke about a document which was presented and it was agreed on. What is the document about? Just if we could get details around that. That's it for me. Thanks.
Tabiso Kola from Eyewitness News. Just please forgive my bluntness, but I have to say this has to be the most vague press briefing I've ever attended. I don't know, is there any details that you can provide us with? There are issues, as you said, Mayor, it's about 2.5 billion for phase 2 of the Rosebar wastewater treatment plant. Where is that money going to come from? Can you get some sort of details? And also, there's I just want to ask, I know the MMC is here, has there been any sort of, in terms of the testing and finding the source of the cholera outbreak, has there been any updates on that? And just lastly, how far are we, is in a consideration to declare this situation a state of disaster? Thank you.
Thank you. Patricia?
Good morning, Patricia Kasafi from the SABC. Minister, you're talking about a milestone in terms of a plan that has been reached or an agreement. Is it possible to take us back? What has been at the center of Tshwane and the department perhaps failing to work together previously? Why has it taken so long for us to get to a point where there is a tangible agreement? Why did we have to wait for people to actually die before the national department intervenes in the crisis in Hammanskraal that we know has been spanning for decades? What was at the center? What is it that has made this agreement impossible over the years? What could you not agree with Tshwane, perhaps the previous mayors, administrations, and so forth?
Thank you, Patricia.
The water crisis in Hammanskraal has been a long-standing issue. And in 2021, the South African Human Rights Commission recommended that the situation regarding wastewater treatment plant and its subsequent pollution of South African resources be declared a national disaster. Why was this recommendation not implemented? Are you planning to declare the failing water treatment plants a national disaster? If so, when?
Can I take these questions up to now? We'll assist one another on this. Talk about the milestone. It's a question that was asked by somebody else as well. What has been at the center? Let me just talk about what we found when we joined the department in August 2021. It was a series of directives that were issued by the department to Tshwane in terms of the law when there's something wrong, either in the waste treatment plant or water treatment plant not meeting the standards. And there are rules and there are compliance issues to which you issue directives for the municipality concerned to comply. There hasn't been cooperation as far as that's concerned. But we are specifically interested in what has stopped, what has been a problem. The real problem was that Tshwane municipality, headed by the then mayor for this one, was that it just was not in the spirit of cooperating with us. You couldn't hold any meeting. He was legalistic about it. You remember, when government of Gauteng made an attempt to impose Section 139, he took government to court, and he won the case, but it didn't win dealing with Rooiwal and the issue of water. Now we, on the other hand, have Section 63 at hand, which we wanted to use to come in, but it is subject to the imposition of 139, and it's now the subject of what we want to review, so that when there's something wrong, it doesn't take us through 139. We go through 60, we apply 63 directly. Otherwise, that became a problem when the city chose a hard line against working with, I mean, there's a letter that even said, no, we want your money, not your intervention. Now, when we had a meeting with Mayor Brink in Cape Town, it took the mayor less than 5 minutes to say what he wanted the meeting for, and it took me less than 5 minutes. And all in all, our meeting was just 10 minutes. He would want the meeting to discuss this, and I said I agree. And I just said, in the past there's been this and this and this developments. So it was a question of not realizing that an issue like this doesn't have to follow, strictly speaking, the spheres of government and the laws. You've got to understand that you have in your hands lives of people dependent on the action that you take, and you just have to do it. Every other thing will follow thereafter. So that was at the center, and we appreciate the attitude, and we just made it possible for us to work. The other question is on Treasury. What have you discussed? Well, at the technical level, discussions have started. That's why we're talking about next week, and we're hoping that in the first 2 days of the week next week, we will have concluded on this matter with the Treasury, but discussions have started. And document, what was the document about? We have said the outcome of our meeting last week was to say we need to set up a technical team that will craft a document that will set out things like the problem statement, things like what is the model that we will agree on to resolve the matter, what funding, where would be this, what would be the source of funding. It's a very important document. It then, when it was presented, it became the main focus in terms of aspects. What does the mayor say about this and that aspect? What do we say? And that is what we say we agreed on in terms of the main frame of the document. But it is subject to a certain finer points being concretized, and that requires other departments, as we have said. It even requires in some areas provincial government, just for them to be part. That is what was contained in the document. What would be source of funding? The source of funding would be the source of funding. That would be identified. That is what we were saying. The technical meeting is going to be about. The DG has undertaken and has been given the job with to just finalize what they've started with Treasury. And from there we will know what exactly the source of funding will be. We'll name those sources of funding on the ones concretized. Then cholera, I think MMC, DM Mahlobo are better placed to deal with cholera. Disaster? No, we haven't gone on disaster, but rather talk about it's an emergency situation that has arisen from the point of view of deaths. Let me go back to your statement. You say, why did we have to wait for people to die? We didn't have to wait, and we didn't wait. We instead, problems were identified, and according to one article from the Daily Maverick, the first warning was in 2004. And then there have been all these other interventions, as I say. Another one in 2007, another, and then the directives, and then us persuading the then mayor when he came in to say, can we, together with you, approach the Gauteng government so that they impose 139 so that we can come in and then assist? It proved to be difficult. It was just a hardened attitude. And so we're not waiting for the tragedy. You can't wait for tragedy to happen before you do something like that. And it's a coincidence that you now have cholera, not elsewhere, but in the main in Hammanskraal, in the context of a long history of problems of water there. Things have come together in that particular way. And that is regrettable. I said yesterday, there's something that could have been avoided, and we should learn that when problems come or emerge, we should resolve them. I don't want to make an example with energy, but I do want to indicate that we are told that warning came in 2007, and look at where we are now. So this human part, this human tendency, the part of the part in the human being behavior of postponing something, which you also do very often in your small life. Sometimes it proves disastrous, and this is one instance where it has proved to be disastrous. I'll end.
Thanks very much, Minister. Perhaps let me try and encapsulate more clearly what this meeting was about. The essence of bad water in Hammanskraal is the state of the Rooiwal wastewater treatment plant. That plant has been out of capacity for a long period. What the Minister has detailed is that far back there has been failure to upgrade that plant, failure to come together. Now, while compliance notices were issued against the municipality, the essence of the question is, how do we find the capital to upgrade the plant within the context of extremely limited resources? Our meeting and the proposal that we now are going to take to other spheres of government, other departments, is a plan to fund the upgrade of the Rooiwal wastewater treatment facility within a specific period of time, and that will finally be a break. So fix Rooiwal, clean the water, get the funding, work together, and by agreeing to this, by making this preliminary agreement, we convey to National Treasury, as well as to other potential assistants, that this relationship is not holding back the solution. So we've been careful not to make announcements that still need to be clarified, that still need a stamp of approval, but the fact that we can agree to a preliminary proposal and go to Treasury and go to funding institutions together and say, here's the plan, here's the time frame, here's the willingness to go and source extra capital together, that in itself, I think, unlocks potentially the funding, but it also conveys to the public that the squabbling between different spheres of government and politicians will not hold us back. That having been said, there's 100 things that can still go wrong, Minister, which we can still dispute and disagree with. But unless we commit ourselves publicly to that solution, I think it will be very difficult to overcome it in the long term. The Minister has detailed the disputes in the past between between us, and of course there's the temptation, Minister, to turn us against each other, to say, to relitigate the things of the past, that, you know, things you and I still don't agree with about the past. But the fundamental point is that the city of Tshwane has failed to address this issue. Various other spheres of government have failed to address this issue. It won't be solved by the issuing of compliance notices. It won't be solved by the HRC making recommendation. It will only be solved by us first and foremost taking responsibility for the problem, whatever happened in the past. And with a kind assistance, we'll be taking co-responsibility. This is a partnership. And I think this is an important way of going forward, and perhaps we can do it so well that it becomes an example to solving these issues in other places. As to the state of the cholera, what the Minister pointed out to me is that there are various entities testing water and water sources for cholera. The city's own tests have indicated that the water coming from the taps is not the source of the cholera. Various other tests on the other two water systems, Mchunu and Rand Water, has found the same. Various tests being done in water tankers. And what the Minister has said, and I agree with him, is we've got to synthesize all of these findings so that we don't run around and do different tests. We concentrate our efforts and actually find the source so that we can work on it. We know that Tshwane is not the only place that has had a cholera outbreak, but it certainly is the epicenter. It's the place where we've got the highest number of cases and infections. And also in that regard, cooperation between the different departments and government entities is very important. I do hope that gives you a more concrete indication that there's good news here for the people of Tshwane.
All right, Deputy Minister, you want to add something?
Okay, no, thank you. And just thanks to Minister, Deputy Minister, the Executive Mayor, and my brother, Force MMC, DG, On our side, Minister, on the task you gave us, we explained that on water there were three components, and one of the components was the lasting solution led by yourself and the Executive Mayor. And we are pleased, like we were reporting yesterday to the committee that you have set up with other ministers, at least a long-lasting solution, because in the meantime, there is an agreement that work must be done on Rooival, and it must be resolved. Because if it is not resolved, all our solutions are not permanent. They will not bring about the change we need. On the other side, where us as DMs and MMC have been sitting, the question of the investigation, we don't want to rush it. There's an agreement, we're not going to rush it, because we need to get to the bottom of this. Ultimately, the agreement is that let's allow the investigation to proceed. There are many people in organizations, like Executive Mayor is saying, they are taking tests. And all of them, they are making pronouncements. And we will always avoid to make pronouncements until there is a complete way of doing this. And the team that will be overseen by myself and MMC Fosi, after there is an agreement, when they've concluded this task, DG is helping to conclude that work with his team. These results will be made public, because to do an isolation and be doing the scouring where the problem is, it's not just that you can do a harsh job. You need to have historical data and events, the time there was an outbreak and post, and then the reliability in terms of stress testing. You'll be able to do that. The second component we're told to do was to ensure that we contain the outbreak, working with those other teams, but from a water perspective, was to ensure that in the meantime, water is being provided in an interim basis, and our interim plan has been implemented. Our teams of City of Tshwane and the department working together, and what has been provided in those communities, albeit through water tankering. But we have ensured that in terms of quality assurance, the water is being abstracted at the right points. Currently, we can confirm is at the right points. There is a monitoring, and the right points are the only two sources, your Mahadis pipeline and the rainwater pipeline. For the issues of human consumption, I must use that word, for human consumption. The issue of the alert that municipality gave with respect of using the tap water from timber plant, it has not been lifted by municipality. That water that is in their taps, and as part of our health awareness, that water must not be used for human consumption. That instruction remains, and from a communications point of view, will do that. But the minister and the executive mayor gave us additional work. We'll look in the meantime while they are doing their long-term solution, other alternative that in a sustainable way, water should be provided through people's taps in a manner that that water is safe, but also in such a way that municipality does not lose an opportunity for revenue. We are very much content, and we are reporting our own contribution in terms of the joint effort as guided by the minister within the broader structure that we announced with the Minister of Health, the province of Gauteng, and including the city of Tshwane. Thank you, Minister, and thanks here.
Thank you, Deputy Minister. Minister Kofi, you also want to add something?
Yeah.
Let me just move the mic quickly. Sorry.
I must thank the Ministry for the intervention into the city. As DM has alluded that there's various institutions that currently still doing tests, and from our side all our tests are on random tracks, are ongoing, and up until thus far we have gotten negative test results. So we do say that the Temba water treatment plant still remains for water that is not ingestible. We want to extend to all the residents that water from the Temba water treatment plant should only be for other use except ingestion. I think that's what we need to emphasize and make sure that our people don't fall into that. Thank you.
And just the one point we committed that will improve going forward is to ensure that, because there's a trust deficit, that the water that is being provided as an interim measure to citizens on an ongoing basis, the water in the tracking system, in the website of the municipality, our technical team from time to time, they will post it so that we manage our relationship with the consumer. Thank you.
Thank you. We'll just take the last four. We'll pick it up from where we left off, and then that's the last round of questions. Thank you. So, Pumzile, let's start with you.
Minister, can you comment on the allegations by African that their water experts have tested water in Bahrain, and it came out positive for cholera, and we want residents in Mwate to stop drinking water from their test?
Thank you.
Lerato Musa from Hawaii. I just want to check, will the investigation also be extended to starter shops? Because now it appears as if this morning we have a new case of a mother and a child who basically think that they consumed water, bottled water bought from a starter shop in the area. So are we likely to also go into the starter shops that are providing water in Hammanskraal just for that case?
Deputy Minister, I like what you say, trust issue. Spent few days in Hammanskraal and tell you that currently residents are scared to drink the water supplied by the municipality because they say they don't know where the disease is coming from. Now, the trust issue is broken. So in the meantime, what is the plan to make sure that the residents have water short-term plan. As a long-term plan, we're busy with it. But in the meantime, we are accepting water from Gift of the Givers. We were there on Tuesday with them. They ran out of the bottles that they had there. Even Gift of the Givers and the churches are asking for donation of water. Some of the churches are inviting residents to come fetch water from the boreholes, those who have boreholes, saying they can trust the boreholes. But in the meantime, what is the municipality and government planning to do in making sure that the residents get water? Thank you.
Is there any more questions, colleagues? This is the last round. All right, well, thank you very much. I'll hand over to the Minister.
Well, I'm sure Deputy Minister Mafego can add, but he has just made a statement, a clear statement, that in the interim, there are two sources of water for Makhalis via Tenkan. It's from a pipe that belongs to Makhalis. There's a pipe that belongs to Randwater. It's an old story that you know, that there are three providers of water there. It's Makhalis, Randwater, and so on. And so, to go straight to your question, there is an interim measure. People are being provided with water that is clean from the Makhalis line and from the Randwater line. We can just say that, emphasize on what has been said, that if people could heed our plea and our warning that they avoid water from Temba because of the situation in which we are, and not use that water, especially for drinking purposes. It is true that needs to be done. That warning needs to be heeded. I hope that resolves your matter. The issue of water being sold by Spaza, I'm sure the city can maybe deal with that. The Paris one, personally, I'm not aware of the AfriForum report, but as we have done here, maybe it's something that we need to escalate to national level and not just focus on Tshwane. We have said Dear Mahlop and then MMC Force, they should coordinate all these people who are investigating, public and private, and done or still being done, including by the health departments. It means that what Dear Mahlop will do will engage Free State, the municipality and the Department of Health there, and even National Department, to make sure that that information is well coordinated. The next thing that is going to happen is by anybody saying, I've investigated and I've made a finding. Now, you can't say no, because this is a sensitive matter. If you reject that, they may have made the finding, and it's dangerous to people's lives. So you run with it. That's why we're open to say, okay, if AfriForum has made a finding, let's coordinate that. Let's welcome that in terms of attitude. But it must be synthesized. We have a Department of Health in the country, and in provinces, and even at local levels, clinics and so on. Those are people who are authorities in terms of these issues of cholera. Of course, if cholera is found in water, as it would have been the case before, we come in there and we care about that. Thank you.
Maybe just to add that what Minister has asked us to do, the trust issue, we're going to restore it. And there is going to be an important civil duty by yourselves also to assist us when we report. Be critical of government, where we have shortcomings, raise them. But where there is a national matter like this one, of life and death, we must be able to be the instrument to disseminate information to save lives and contain this, because nobody will be able to sleep knowing that in one way or the other, through our mishaps or missteps, certain lives are being lost. But the ministry, through Minister Mchunu, will engage with the DG to help us. Water services authorities, in terms of their constitutional duty, when they provide water, people with water in an interim measure, they have a responsibility to take all the precautions to ensure that where they abstract the water is of good quality, it meets our norms and standards in terms of drinking water. That's a responsibility for all of them. And if they don't do that task, the minister has an authority to act on those particular water services authorities. But secondly, how the water is being handled from the point of abstraction until it arrives in people's homes, and how we are going to actually ensure that all water service authorities, they must publicize their results when they are providing people a temporal measure, because water must be tested, and they must do self-regulation to test it and report. That's the requirement. But citizens, we need to up our civic education. Water that is not coming from the tap, that has not been guaranteed by the Water Services Authority that it meets the standard. Issues of health and hygiene must be implemented. Washing, boiling that water, using whatever detergents that are permissible, that are being advised, so that we don't cause problems. That is our message around dealing with those issues. But as we are saying currently on record, where Tshwane is taking water right now in the two sources the minister is giving us, we are very confident is of good quality, very good quality. But to assure, MMC Force very shortly with his team must start to assist us by posting those results in the website that their citizens are able to access.
Yeah, so let me just say, we'll certainly investigate the instance of the spaza shop. Folks have to bear in mind that cholera is not just spread via water or contaminated water. It can be spread by the handling of food, poor hand hygiene, the practice of, for instance, submersion in water for baptism is very common practice. So we're going to make sure we investigate all of these possibilities and then find the epicenter of where this broke out and trying to contain it. The issue of trust, I think the Deputy Minister mentioned. We supply water via the water tankers, but I think the point you're making is that there's even distrust of the water tankers. And the message I want to send is that the moment this occurred, we immediately sat with the officials and we said, how many tankers go to informal settlements? How many tankers go to formal settlements? How do those performance contracts look? Do we have the measures in place to check that they in fact abstract water from the lines mentioned by the Deputy Minister? And we're tightening those controls. But as a backstop, if there's distrust of even the water on the tankers, residents can take the precautionary measures of boiling the water, the salt solution, treatment of the water. But from our side as a municipality, we'll investigate all of those instances. There's also instances of open sewers that I think are also of concern, sewer leaks and so forth. And as well as making sure we turn the screws on the water tanker business and those contracts that we have. Thank you.
Right, thank you, Mr. Mayor, and thank you, Minister and Deputy Ministers. Thank you, media colleagues. I appreciate your time, and I'm sure we'll make a opportunity for one-on-one. Thank you very much. That's the end of it.
They're requesting that you sum up in the minister, so that they can capture it. Yes.
You should have said that earlier. Yeah. saxoxa ukuthi kunesidingo sokuthi sihlangane sixoxe ngeindaba zamanzi kakhulukazi aseHammanskraal osekube indaba ende kodwa enemphumela engabonakali engabambeki uxatshano phakathi komnyango kanye nomasipala kodwa kungaxazulula inkinga ilokhu iqhubekile inkinga osekuze wafinyelela la khona phezu kwensolo zokuthi not insolo phezu kwesimo sokuthi kunamanzi angahlanzekile angaphuzeki Hammanskraal sekuvela ke manje icholera sekuvela ukuthi abantu balahlekelwe imiphefumulo yabo abawu-21 so namhlanje ke sithe ake siyivale le chapter yokungezwani nokungabambisani nokungaxazulula inkinga khulunywe nje